What's up, everybody? This is Dr. Emmanuel with Medical Bellator. All right. Today's topic, we'll be talking about brain malformation. But before we proceed, subscribe to my YouTube channel. So, today's topic, we'll be talking about brain malformation in fetus or baby. First thing we'll talk about today is lissencephaly. Lissencephaly, what does that mean? Encephaly, as we already know, is called what? Brain. Lease, smooth brain. Lissencephaly goes into smooth brain. Normally, the human brain is supposed to look like this. But what happens when there is some brain malformation that leads to this? The brain becomes smooth. You barely see the circles or the sulci, or you barely see the gyrus or the gyri. All you see is smoothness. There is no appropriate demarcations to differentiate the motor center from the sensory center or every other marginal zones in the brain. What usually causes this is mostly caused by genetic mutations. Sometimes it can be as a result of failure for the neuron to migrate, leading to formation of all the sulcus, gyrus, and parts of the brain that is needed for a full development of a child. Sometimes it can be non-genetic. It can be due to viral infection that the mother contacted during pregnancy, because this commonly occurs within the 12th week to 24th week of pregnancy. Sometimes this can also be as a result of what? Decreased oxygen perfusion to the brain of the baby. So, what are the common signs and symptoms we can see in a child who has this issue, lissencephaly? Let's start from the top to the bottom in order. Number one, let's start from number one. We talk about what? Delay in the development of the child. Number two, there will be some cognitive disability, possibly. Number three, seizures and epilepsy. Number four, we can see facial anomalies. Number five, difficulty in swallowing, also known as dysphagia. Number six, muscle spasms. And there are so many other symptoms, but these are common in children with lissencephaly. What is the other common brain malformation mostly seen in children or in the fetus? Next is holoprosencephaly. Look at the name, holoprosencephaly, prosencephalon, the forebrain. What's happening here at the forebrain? There is a difficulty or absence of separation of the cerebral hemisphere into two. Sometimes holoprosencephaly can be semi-lobar, alloboprosencephalon, or loboprosencephalon, depending on what or how much of the brain were separated, because the human brain during proliferation and differentiation in the fetus is supposed to fully separate. And this usually occurs around the third to fourth week of gestation. They're supposed to separate and be held together by the corpus callosum. But in this case, there is no separation depending on the degree. When you say allobar holoprosencephaly, what does that mean? Take a look at the picture. When it comes to alloboprosencephaly, the brain hasn't divided into two at all. It hasn't divided into two cerebral hemispheres at all. There's a loss of midline structure of the brain and the face. And as well, there's a fusion of the cavities of the brain. There's a fusion present. This form is usually severe, and many children who are being born with this defect are mostly stillborn. They are mostly stillborn. Now, when you look at semi-lobar holoprosencephaly, semi means what? Half. Take a look at the picture for that. This type usually occurs with partial division of the brain. into left and right, or left and right hemisphere. Partial, all right? This usually happens when the left side is fused to the right side in the areas of their brain known as the frontal and the parietal lobe. You will see that mostly in the frontal. This is the frontal, and this is your parietal. That's where you mostly see this. Now, many children, we go through this, usually make it through life, but they will be severely disabled in most cases, or profoundly disabled. Now, what's the next type? The next type is known as what? The lobar holoprosencephaly. Take a look at the picture here. So what you see is the brain is almost fully divided, but not into two halves like it's supposed to be in every viable human being. Now, this form has the left and the right ventricle for the two hemispheres, but it's not fully divided. This is the mildest form, but at the end, there is a high chance of disability with such individual. What usually causes the holoprosencephaly? This is due to mutation in the sonic hedgehog gene protein. There are so many other genes that can be affected, up to 14 of them, but the most common one is the sonic hedgehog protein. So what are the common clinical symptoms we see in children or babies with this brain malformation? So let's start from the top. Number one, most times you will have signs of seizures. Another thing you will see is developmental delay, intellectual disability. There are, in some cases, their head is smaller, which is also known as microcephaly, or macrocephaly in the case of big head or large head. Cleft lip, cleft palate, facial anomalies, tooth abnormalities, feeding difficulty. So usually from the third week, the forebrain or the prosencephalon should start developing fully and start dividing as it's supposed to be. Now, these defects is mostly seen around 3 to 4 weeks. I'm talking about holoprosencephaly. You see this defect mostly in the third and fourth week. Sometimes when the baby has an alcoholic mother who drinks lots of alcohol and they get pregnant and not knowing that they are pregnant and they still drinking alcohol, there's a high chance if they keep on drinking alcohol through the pregnancy, these defects will develop. This is commonly seen in a condition called fetal alcohol syndrome. Holoprosencephaly is usually associated with fetal alcohol syndrome, apart from the sonic hedgehog gene mutation. Also, this is also seen in children who develop Patau syndrome when it comes to trisomy 13, chromosomal abnormality. But remember, majority of the time, these children have profound or develop a profound disability. In many cases, in majority of the case, they are stillborn. In fewer cases, if they make it, they are profoundly disabled. So remember that.